So Eyewitness News has gone around the country speaking to doctors, speaking to nurses, trying to find out their experiences. They're dealing with patients, but obviously many of them will have loved ones who've been affected, and they've been watching their own colleagues succumb to this thing. So before we catch up with Mia Lindeke to just hear what her interviews have been like, what the stories she has heard, have a listen to this healthcare worker from the Western Cape.
You can't even commit to say you'll come back and work harder again on your patient, because you might arrive there and the patient is no longer there. You are wrapping bodies, body after body after body on this 12-hour shift. It is draining. It has been difficult. In the first surge, there was more hope. There was faith, more patients going home, rather than the second surge. In the second surge, I don't know what was going on. It was just like a purge rather than a surge. Like the loss of life became a norm. It's like part of a 12-hour shift standard procedure that there's going to be life lost. It's terrible. It's so terrible that you'd see patients in critical conditions, severe critical conditions, and there's nothing else that can be done for them. There's no spaces in ICU, there's no beds in high care. It's just terrible. Initially, it was adults, more grown-up people that were going through this. But this time, the second wave just came for the youngsters as well. I remember I had a 32-year-old patient that had a 2-year-old daughter. She was fighting for her life. I had a 28-year-old patient who had a 5-day-old daughter who lost her life as well. You find that your patients in the high care units, when you go over to work there, the patients' conditions are changing. They're becoming anxious, more anxious because all the other patients that they had been sharing a cubicle with are no more. They've been collected by the undertakers.
What a story, hey? More of a purge than even a surge. Mia Lindeke joins us now in the studio. Gosh, what did you find? Just give us a broad overview. How are these frontline care workers doing? What did you see in the wards that you were able to get into, or at least what are they telling you?
So, Bongani, it doesn't matter how many times you listen to this interview, it hits hard every time. And, the picture that we've been collecting across the country, it is that, we can look at the numbers, but it is real for these healthcare workers. They have described how they have to wrap body after body on these 12-hour shifts, how they've somehow became desensitized. It's a norm for them. They know it's part of their work. But for me, what they also described is, how helpless they feel when they watch how people die in front of them. One doctor that I spoke to, Dr. Caroline Lee, she's an anesthetist in Johannesburg. She said, it's so hard to watch how people are trying to breathe on oxygen, but they can't. You almost want to breathe for them.
Gosh.
But you have to watch how they die. And that for her is really so difficult, because she says it's a constant juggle between who needs the oxygen more than the other one, you know? It's those tough decisions.
They have to play God here, right?
Exactly.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.